everybody, welcome to the C.E.S. YouTube channel again. This is Ellie here and I am a registered physiotherapist. So today I would like to talk to you guys about the sacroiliac joint, or the SI joint in short. This joint is between the sacrum and the ilium bones of the pelvis. In humans, the sacrum supports the spine and the sacrum itself is in turn supported by an ilium on each side. So together, they form our pelvis, which supports the entire weight of our upper body. The human body has two SI joints, one on the left and one on the right. Common problems of the sacroiliac joints are often called sacroiliac joint dysfunction, also termed SI joint dysfunction. This condition generally refers to pain in the dimple of our lower back that is caused by abnormal motion in the SI joint. It usually causes a dull, one-sided low back pain or an ache. This pain may become worse or even sharp while doing activities such as standing up from a seated position or lifting knee towards the chest during stair climbing. When the condition becomes worse, pain can be referred from the SI joint down into our buttock or even to the back of our thigh. So to prevent this condition from happening or to help reduce the pain of this problem, we should really strengthen the muscles surrounding our pelvic region. So I picked out two very effective exercises to show you all today. They're not that hard. And the first one is called the side lying clamshell exercise that focuses on strengthening our gluteal muscles, especially our gluteus medius muscle. And I will also show you guys a progression with resistive exercise band for this exercise. And the second exercise is called the bridge that strengthens all our hip extensor muscles and promotes trunk stability. And if the bridging exercise is too difficult for any one of you to do, then I will be showing you guys an easier variation of this bridging exercise, and it's called the pelvic tilt. So without further ado, let's grab our mats and we'll get started. So we'll get started with our side lying clamshell exercise first. So you can use a pillow and go onto your side. So lying on your side with your knees bent. And then you can place the top hand just right around where the gluteus medius muscle is located. Generally, I tell my patient that that would be the back pocket area. So if you wear jeans, you will have back pockets, and that back pocket area is where that muscle is usually located. So you put that hand there to just feel for the muscle working when you do the exercise. Then to do this exercise, you will have your heels together, and then you lift the top knee away from the other knee, and then you will hold in this position. So you will notice that my knee and my hip, they're aligned. So my knee doesn't go past the hip level. So it's just aligned. They are aligned, and then you will hold for a count of 5 seconds up to a 10 seconds hold, and then you will bring it back down slowly. Then you repeat that again. So again, hip level, hold it 5 seconds. If 5 seconds is too easy, 10 seconds. And you will repeat this exercise 10 times on the one side. Then once you're done on this one side, you will go on to the other side. So lying on the other side and do the other hip. And if the exercise becomes too easy, then you will use exercise band to make it more challenging for you. So here I have a firm resistance exercise band that I'm gonna tie my legs together just to make a tight loop. And you can actually use the exercise loops. There are lots of exercise loops out there that you can purchase nowadays. Those ones would work. Those ones would be very simple. You simply just have to bring the loop up to your thigh area. Then you lie down onto your side again. Knees bend. Hand on the muscle area. And then lift the top knee away. Again, to the hip level, hold 5 seconds, up to 10 seconds. If 5 seconds is still too easy for you, then you bring it back down. And same thing, you repeat 10 times on the one side and then 10 times on the other side. So this would be the clamshell exercise and side lying. Next is the bridging exercise. So we don't need the pillow for this. You will just have to lie onto your back. You can separate your knees a little bit so then they're hips width apart and knees bent. And what you're gonna do is with this exercise, you just have to bring your hips off the mat. So you're bringing your bum up. And when you're doing this, you're activating all your hip extensors muscles here, and also it trains your trunk stability when you're doing this exercise. You hold this for 5, 4, 3, 2, 1, and then bring it down. So if 5 seconds is too easy for you, then you can hold up to 10 seconds, and then you repeat this exercise 10 times. And if the bridging exercise is very challenging for you, you can start with a mini bridge and then a half bridge and then eventually a full bridge. And if even a mini bridge, a mini lift is challenging, then you can start with a variation of this exercise, which is called the pelvic tilt. So essentially you're just lying down on your mat, and what you're gonna do is you're going to posteriorly tilting your pelvis like so. So you're tilting your pelvis this way. You're doing a posterior pelvic tilt, and you will do so by activating all your glute muscles to do so. And then hold this for 5 seconds. And then once 5 seconds is up, you can release and then repeat the exercise, that's motion, again. So this exercise you can do 5 seconds up to a 10 seconds hold, 10 repetitions, and once you've mastered this pelvic tilt, then you can attempt the bridge again. Okay, so I hope you guys enjoy these 2 exercises, and if you have any questions, please comment down below. And if you like my video, or if you would like to receive more self-care tips, then please like and subscribe to my channel and turn on the notification button, and I will see you guys next time.